Check the ferritin, check the ferritin, check the ferritin. That's what you hear when you're going for an evaluation for fatigue or hair loss, because we're trying to assess your iron deficiency. What you don't know is that ferritin is also an acute phase reactant. This means this particular protein can be elevated in patients who have inflammation from any reason. For instance, autoimmune disease, chronic infection, malignancy. Ferritin is also not reliable in patients who suffer from liver disease and kidney disease. It is for these patients that we need to look elsewhere. We need to look at the whole clinical picture. We need to check the CBC, sometimes even do extra tests such as a bone marrow biopsy, an endoscopy, and a colonoscopy. I personally have had some really challenging cases in my practice, and we could just not figure out why the patient's ferritin was so high, but the patient was so anemic. It was not the bone marrow, it was not the colon, it was not the esophagus, it was the small intestines of this particular patient that had small arteries that were bleeding. The point I'm driving at is that in medicine, a lot of things are nuanced, and you have to see the whole clinical picture if something is not making sense. If you found this helpful, follow me for more autoimmune content.